In this tutorial, we're going to be talking about sports massage therapy for neck pain. Now, I'm going to keep it general, but we are going to be looking at some specific parts of it. Reason I'm keeping it general is so we can cover as many bases as we can to give you a best understanding about sport massage therapy for neck pain, and then maybe in future tutorials we'll look a little bit more on specific types of neck pain or specific tissues within neck pain. So as you can see on the screen, we're going to be basically taking you through 3 bullet points. We're going to look at potential muscles involved, trigger points of those muscles, and then compensations and how that would then, in some respects, spread into other areas of the body, because it's not always, certainly with sports massage, about just staying with the neck. We've got to look elsewhere to be able to get rid of or manage any residual tightness that appears in other areas of the body. So we'll look at that as well. So when it comes to treating neck pain, as I mentioned in the previous slide, we're looking at potential muscles involved. So we can't be, certainly when we're just talking about general neck pain, certainly for this type of video, I can't be specific and say it's this muscle, it's that muscle, it's another muscle. All I can do is look at potential culprits that are creating the pain. And in some respects, when I start interacting with a client, it will start with an initial questionnaire to try and get some data, to try and understand where the pain is coming from and what's potentially triggering it. So this, in some respects, is how I would go about understanding someone's neck pain, looking broad and then gradually getting sort of more specific and more specific. So 4 potential muscles that I would be looking at. Number 1 is, and it's not in any particular order. Some of it may come from the initial questionnaire or the start of the consultation. So they'll fill out a questionnaire, I'll get the data, I'll book them in, they'll come and see me for a consultation, and then I'll add some further supplementary questions to try and understand a little bit more about the neck pain and sort of where it's coming from. And one of the muscles would be scalene. Now, these are the muscles at the side of the neck. There's 3 of them. As you can see on, well, you may be able to see on the screen, you've got anterior, which is front, medius, middle, and then posterior, back. So they're basically at the side of the neck here, if I was just to sort of point in a general position. So we've got these muscles here. So these muscles may be tight. They may have trigger points within them which are creating pain. The second one, slightly longer name, Sternocleidomastoid. But basically, as you can see on the screen, it's this big muscle here that comes down from just behind the ear and essentially sort of onto the front of the neck here, or the sternum here. So if you were to grab a hold, so if I was to sort of grab a hold of the side of my neck, it's that muscle there, basically, the sternocleidomastoid. So it runs down there, and this one rotates the head. These laterally flex, this one rotates. Third one, levator scapula. You can see just down at the bottom of the screen here, you've got this muscle. This is a little bit more towards the back of the neck now. It joins the top of the shoulder blade, as you can see here, into the neck, onto the vertebra of the neck. And again, it will go into, the name obviously suggests a part of what it does. Levator scapula elevates the scapula, but also is joined onto the neck, so it can assist in holding, if you're a cyclist, holding one's head up, or if you're sat at a desk and you're slouching and then you sort of lift your head up, again, that will be another part of that one. So you can start to understand what might be triggering it, how you go about treating it, so on and so forth. And then the final ones is this occipital group, which are basically in this area, which is the base of the skull back here. And these are stabilizing the top 2 vertebrae, the atlas and the axis, and it will go some way to assisting the movement of those vertebrae. So those are potential muscles involved. What we'll now look at is we're now starting to sort of branch out, and we'll look at some trigger points and what type of pain these muscles can create. Trigger points are essentially active muscle knots, and what they do is they create pain in different places within the body. So as you can see at the top here, this is the scalene trigger point. Now you can see there are trigger points on the neck, which are these little dark crosses, which you may or may not be able to see, but I'm just going to highlight them in orange. And then what happens is each of these trigger points will send pain to certain areas. So you can see one in here, but you get the pain sort of just to the side of your bicep. So you can see on the back, and then forearm and down into the hand. And then you've got other ones which go down into the pec and then also down the arm as well. So you may be experiencing pain in these different areas, but the actual problem is coming from these scalene trigger points. So it's trigger points are essentially understanding where the pain is, and then you can, in some respects, you can trace it back to certain trigger points, or you can at least be well informed enough to be able to treat that, to see if it has an effect, to then see if it's the trigger points or not. Then we come down, next image down, sternocleidomastoid. So you can see the trigger points coming up the sternocleidomastoid there. And then again, you can start to see this is sort of pain in and around the eye from the temple and around. You'll have some on the back, potentially some on the chin. So you can see all these different areas. And then you've got in the ear, front of the forehead. So you may be experiencing pain here, but it's actually in the neck here. Levator scapula, starting to move. So where we've been sort of looking down the arm, we've then looked up onto the head. Now we're looking down at the back of the scapula and the shoulder. So again, we've got this would be, most people would consider that to be neck pain. So we would look at that, and then you would go down into rhomboids, potentially into infraspinatus as well, and you'd have pain there. But we would be looking at the trigger points within levator scapula for that. And then finally, the occipital group, where again you can see muscles, the trigger points at the back of the skull there, and again you will have the pain going right across sort of the top of the ear, in front of it and behind it. So this again is, we would, if it was trigger point, we would be treating the specific muscle. What we would then do is what we're going to talk about in the next slide, is start looking at the residual tightness that might be coming about, and then you could even expand, looking at these muscles that are compensating and have residual tightness. That could then activate trigger points and send it elsewhere. So even if you come with shoulder pain, it could trace back, because we treat those trigger points, it could then trace back up into the neck as well, because pain has a funny way of sort of taking you on a little journey with regards to how it's treated. Again, these are just potential muscles. There are many more muscles around here. So we've got supraspinatus, which is this muscle on the top of the shoulder blade through here. Now again, this will have its own trigger points. There is also another injury at the shoulder, which is impingement, which will happen where the bursa gets where the bursa traps the supraspinatus muscle, or it gets compressed and creates irritation there. So that can be with regards to shoulder pain. So there may be, you may come with shoulder pain, but what you may then find is it traces itself back up into the neck. You've then got rhomboid. So these are areas that I've talked about with regards to trigger points. So the pain could be coming out there. There could be residual tightness there. So the rhomboids are up here. Now with regards again to the levator scapula, you get pain that comes down the inside of the shoulder blade, which is the rhomboid essentially. So we would be treating the rhomboid, and again it can trace itself back up in. What we've then got, upper trapezius, which is this muscle. Obviously it's on both sides, but essentially this goes up into where these occipital group are. So you may get, and if we're looking at upper trapezius, we would be looking at this part of the muscle. Then we've kind of got the mid and the lower. So we would be looking at tightness through this area, and then these muscles are underneath the trapezius. So you've got the rhomboid obviously on the other side down through here, and then you've got supraspinatus coming over through here. So where we may start working through the neck, the sternocleidomastoid, the scalene, levator scapula, so on and so forth, we then have to come down into the shoulder, into the upper back, to try and release any residual tightness that's being created. And that may then, if you come with shoulder pain, it might then take you back into the neck. So shoulder and neck pain are quite closely related in the way that the muscles will interact with each other, because if you come with shoulder pain, you can get trigger points that go up into the neck, and obviously we've seen you get pain up in the neck. You have muscles in the neck, you can get pain down in the shoulder. So there's this sort of crossover. So it takes a little bit of evaluation and analysis to be able to do that. So again, with regards to my sports massage therapy, that's exactly how I take it. You fill out initial questionnaire. That helps me prep, understand what questions I need to be asking, what potential assessments I need to be doing in that particular area of the body, and any other areas of the body as well that might be worth looking at. We can also look at upper back range of movement, because it could be coming from the neck down, it could be coming from the spine out. So there's all these different ways that we need to understand where the pain is coming from and how we need to go about treating it. So hopefully it's given you a little bit of a better idea and some degree of understanding of what might be going on with your neck pain. But that is all I'm going to go through for now. So my name is Chris from Chris for Whole Training. I'll speak to you in the next tutorial.